Hey folks, this is Chris Temple, editor and publisher of the National Investor, and today I'm wearing an additional hat. I've partnered with my good friends Rich and Eric Redez. We're putting together, as a lot of you know that are seeing this video, the Strategic Investment Insights 2022 conference in the Chicago area. It's going to take place the 6th and 7th of May. If you haven't done it yet, I encourage you and urge you to go to our website, strategicinvestmentinsights.com, register to attend. It's free. There's a lot of interesting panels. We're talking about a lot of different themes in our emerging world, as frankly, the old world order, so to speak, economically of the post-World War II era is unraveling, and a new world is going to be emerging. There's all kinds of implications for that. One of which is, together with the cyclical bear market that has now started on Wall Street, which may not lead to a complete debacle, but people are going to have to work harder now to research companies and make their investment decisions. It's really an exciting time from that standpoint. Now, today, we're going to give you a preview of one of the dozen and a half or so companies total that we're going to have at Strategic Investment Insights. I'm going to introduce my friend, Dr. John McGraw, who is the CEO of Izotropic Corporation. John, thanks for coming on with us today and giving a little overview of Izotropic.
Oh, thank you. It's my pleasure. I look forward to seeing you at the conference.
Well, it'll be fun. And actually, you and I are going to see each other between now and the conference. We're both going to be at the Noble Conference downstate in Florida here the next week, the week after Easter. So that'll be great to catch up with you there as well. Folks, I first learned of Izotropic several years ago. A very dear friend of mine of many, many years, who is a founder and a former chairman of the very first company to ever list on a Toronto Venture Exchange. Great mining story, Cornerstone Capital Resources. He called Izotropic to my attention. And what I found interesting, because I'll look at companies in any industry, any sector, if they make sense, if the dynamics and the pieces are there, I'll do my homework, and then eventually, as I did in the case of Izotropic, recommend them to my own subscribers at the National Investor. And I'm happy that John, of course, is also coming to our Chicago conference. But, you know, a lot of us have been touched over the years with the illness or death of people that we love due to breast cancer. My mother being one of them, who sadly died way too young in her life. Most of her family lived well into their 90s. She only made it into her early 70s after her breast cancer recurred. And so clearly one of the attractions to me of learning about Izotropic was to see what they really have. What chops does this company have in the next generation, if you will, of standard of care to get earlier, better, more accurate detection of breast cancer and hopefully save a lot of lives. So John, give us a quick view of Izotropic, and especially your IzoView, which is in advancing development, hopefully will be in trials before long.
Yeah, that's great. You know, IzoView really is a dedicated breast CT imaging device. Now, what does that really mean? You know, we all know what CT imaging is, or maybe experience. It's taking a lot of X-rays and putting them together into a three-dimensional image. And what we're doing here is combining that with breast imaging, which traditionally has been focused on compressing the breast and trying to get like a two-dimensional image. We know there's a tremendous gap in terms of breast imaging and diagnosis and imaging capability. So we're putting these two things together and making a device that a woman can just get on a table herself, put her own breast into a cup, have it hang freely without having the painful compression associated with breast imaging, and taking about 500 images in about 10 seconds and reconstructing that into a three-dimensional image. And then we can use contrast with it to identify the tumor even better. And that's really exciting. And every woman I talked to said, we would like this now. So we're trying to get to the market as quickly as possible. And that's what we're developing. That's IzoView.
Well, you know, I've read a lot of the material that you have put out. You and I have talked a couple times in the past. We've done interviews before. I've written a lot about Izotropic. And one of the things that I think struck me a lot was the polling of a lot of women who tragically will delay mammograms because they talk to a friend who's had them or something like that. And it's just a really unpleasant, intrusive experience. And this really negates a lot of that. So I'm excited for you. Now, you recently announced a couple additions to your team. More importantly, you have moved, even though your corporate offices are in Vancouver, British Columbia, you've moved pretty much all of your engineering and research and that type of thing down to California. Tell us the significance of that and the team and the technology as it evolved into what is now the work in progress called IzoView, led by Dr. John Boone.
Yeah, well, Dr. John Boone actually is at University of California, Davis in Sacramento. That's where the 4 prototypes were developed. As Izotropic was getting going, we worked with an engineering company in British Columbia, in Victoria, to take the product and start to commercialize that. And as we started doing that, we brought on Yunus Askir, and really, he is a tremendous engineer, and he's in California. And as we, I think, moved through COVID, and and that started to open up, and we were having people go back and forth across borders and our supply chain, everything started to just coalesce around California. And not surprisingly, it's Silicon Valley, and it's the heart of drug development, computer development, medical devices. There's great companies there and great resources. And so it just made complete sense, number one, to focus all of our engineers in one spot, because engineers are approaching us now saying, with tremendous skill, saying, I want to be a part of this company and work for this company. So that's a great thing. Like there's this collection of people coming, wanting to be a part of this. The second piece is we focused on the United States. We had ambitions to, expand it to Canada, but I think really COVID demonstrated, let's just focus on one country. Let's be as efficient as possible. That's where our customers are ultimately going to be right off the bat. That's where our clinical trial sites are. That's where our clinical sites are reaching out to us and
Right.
said, we'd like to be part of this clinical trial, which also was very unusual for a company to have, institutions reach out to us. So it's from an engineering perspective. We just brought on Dr. Shadi Shakiri from UC Davis as a clinical advisor. She is now able to work with us because previously she was working on a breast CT imaging trial compared to MRI. Now that that's wrapped up, she's no longer conflicted. So now you can see this team and engineering, clinical, potential customers, all coalescing in one spot. And that's really exciting for us. So that's going to sort of accelerate pieces of the development, make it more efficient. But also, I think, as everybody knows, as you start to bring groups together like this, you bring together this critical mass.
Right.
And we're starting to see that, things start sometimes slowly and then they start to accelerate in any company. And that's what we're seeing here. And so that foundational work that we did in Victoria was so instrumental in getting us, to a spot where then we could sort of transfer, and it just made sense. So that's sort of the history of that.
Yeah, when you made that announcement of Dr. Shakiri, I thought it was remarkable, and because she's not the first who you've brought on board in some capacity with Izotropic, who either helped to develop, and correct me if I'm getting the terminology incorrect, John, helped to develop or actually is implemented the current standard of care for mammography. And now all of these people pretty much unanimously that you've brought on board believe that IzoView will be the next better standard of care, and they want to have their shoulder to the wheel with you.
That's correct. Today there's mammography, which is 2D, and there's tomosynthesis, which is you move the emitter back and forth, and that's, we call it 2.5D. I think the market calls it 3D, but we consider ourselves 3D. And that's sort of like a 15 to 50 degree view. Dr. Martin Yaffe from the University of Toronto, he's one of the founders of digital mammography, and he's on our advisory board. And so that's an example of a key person there understanding the market. Dr. Tao Wu, when he was at Harvard under the direction of Dr. Dan Kopan, he was also involved in the development of digital tomosynthesis. And that product went on to be transferred to Hologic, and really was foundational for what we see the tomosynthesis market, which is representing about 50% of the total, market in breast imaging, breast screening and diagnostics. So he also has joined our advisory board. But these two foundational people have been involved, and Dr. Shakiri has been involved with the clinical development of the previous prototypes in Dr. Boone's lab, and used it in a clinical setting. And she's quite effusive in the quotations and in the press release,
Right.
About how excited she is about this. And I think when we have people every step of the way in the development of, I think breast imaging, from the beginning of the technology where we are today in the leading edge and where it's going to, wanting to be a part of this, that's really exciting for us and validating for such a small company.
That's neat. And I want to underscore that, folks, as we end here. First of all, of course, encourage you again to register for the conference. If you can't make it in person, you can register online anyway. That will give you access to a lot of the information, the companies and so forth. But the one thing I want to point out that Dr. McGraw said, for a small company, a statistic that I'll be sharing at the conference and probably in between more than once, is that the worst time possibly to ever have been an investor in the stock market on the surface was in September of 1929. There are a lot of people that wonder if we're in for a long slog or bear market again. It doesn't matter in some respects. Back in that era, in the Depression, from top to bottom, the Dow Jones average declined by 89%. Yet 1 out of 3 public companies were higher in price during that time. They were ones involved in areas that were defensive. They did things better than their competitors, et cetera. Today, we have advances coming out in medical science. I believe Izotropic has got a shot of being a major disruptor. And folks, if they can succeed, if they develop IsoView, they get it in a clinical setting, and this is adopted by practitioners who today are doing mammography and next time might be doing something better, it's not going to matter what the NASDAQ is doing. It's not going to matter what the Dow Jones average is doing. This will be a story that people will want to be part of. So again, register, learn more about Izotropic. John's going to go into a lot more details. And John, I'm looking forward to it. I'm excited. Take care.
Thank you very much. I'm looking forward to seeing you soon in both conferences.
Yep.
Thank you.